Medical Research Council Ethics Committee, and today I'll just be sorry, I'm just trying to if I can, yeah. And so today I'll be talking about Aboriginal health research ethics and research around, and the topics I'll talk about are the context of research and its relevancy today for researchers, the research criteria for the AH&MRC Ethics Committee, Aboriginal health research around the principles, and the review process. So I think if we look at Aboriginal health research, there's different contexts or circumstances that have led to the development of principles and the development of the Ethics Committee today. And those are around a cultural context, historical and political context. And I'll go through each of those to help put it in modern context research today. So I'll just provide just a bit of background. So the AH&MRC is the Aboriginal Health and Medical Research Council of New South Wales. It's the peak non-government organisation on Aboriginal health in New South Wales. It was established in 1985 and its membership consists of 49 Aboriginal community-controlled health services, which are also known as ACCHS. And from this community-based membership comes the AH&MRC Board of Directors, which provide oversight and governance over activities at the AH&MRC, which includes public health units around public health issues, blood-borne viruses, cancer, chronic disease, sexual health, tobacco, social emotional wellbeing, child maternal health, drug and alcohol, to name a few. They also run a business development unit which is specifically for our member services around IT, quality improvement, information systems and workforce. It's also a policy unit, research and data area. We also operate an Aboriginal Health College, which is for building our own Aboriginal workforce, clinical workforce, managerial workforce. And then the AH&MRC also operates an ethics committee and secretariat, which is really auspiced by the AH&MRC, but we're independent and we're an NHMRC registered ethics committee. So a bit more just about the detail around the membership of ACCHS because it's relevant in terms of getting support for Aboriginal health research projects in New South Wales. So there's 49 Aboriginal community-controlled health services, and they're services that operate as medical clinics, health clinics throughout the state. They're created and governed by local Aboriginal community. They operate under an elected local Aboriginal Board of Directors, and those ACCHS are majority Aboriginal staff and a major employee offered in a lot of the rural communities. And we also have Aboriginal community-controlled health-related services, which are services like rehabilitation centres or specifically like a women's health clinic. So in terms of the different contexts around research, if we look at the historical context of research, unfortunately a lot was focused around social research and genetic research, and it was often done off the platform of looking at really classifying and labelling Aboriginal people in terms of how to manage them. And the social research was often around looking at it, was used to really justify problems with Aboriginal people. It was often viewed in isolation. It didn't take into account any of the cultural impact or social determinants of health that we recognise today, and it certainly didn't account for these external events or the researcher's own cultural viewpoint. Around the genetic research, it was often focused on physical characteristics and measuring those physical characteristics, and the outcomes of that is that a lot of the historical research was put out as a problem research and that there was a solution mentality, and it was often that the solution was that the exclusion of Aboriginal people, and in that it was that Aboriginal people were passive objects, that they required assistance, and it was often that there was no internal expertise was considered in the Aboriginal community, and so we needed external experts to come in and provide solution to problems. Some of those outcomes were also, particularly around the genetic research, was about supporting that the savage mentality of Indigenous cultures, not just here in Australia but around the world, and often it was around supporting that there was inferior intelligence attached to Indigenous people. There was also around, particularly around that Aboriginality was based upon physical characteristics, and that the bloodlines, and that was what the value of ancestry of being an Aboriginal person. This also tied in with political context, and I guess it's part of this ongoing political context, but certainly back around that historical context where we look at the interactions, the political context around initial settlement and colonisation, went through protection and segregation eras and assimilation eras. We had integration, self-determination and self-management policies, and we moved then later into the reconciliation era, and social justice partnerships and royal commissions were certainly characteristics of the political context around 2000, and was now in the, I guess you could say, close the gap health equality era at the moment. So in terms of all those different policies and interactions, the relation in effects, I guess, of the modern research process today is that they had a clear impact on intergenerational social and emotional well-being, and they're aspects of that interaction that researchers have to take into account today. Part of those interactions where there was often then thought through research that there was a genetic value of identity, and that led, of course, to a lot of the Aboriginal Protection Board policies, such as the stolen generation, where there was this thinking of what was Aboriginal identity, and that it was based on physical characteristics, particularly around skin colour. There was also educational barriers where there was this knowledge wasn't, where that education wasn't open to Aboriginal people, and that lack of knowledge, and that's certainly a legacy that's been, it's an unfortunate legacy that's been passed on intergenerationally as well. That also bred a fear of and lack of trust of particularly research institutions, and it bred a lack of trust in researchers, where there was often seen that it was researchers were creating this false knowledge and interpretation of the data that they collected, and an outcome of that is that unfortunately a lot of that research was then formulated into incorrect, inadequate policies. Part of that interaction was also the research process was that there was also this continued comparison between Aboriginal people and this general population or others, and that's often was characterised by inappropriate policies and this authority thinking that it was people in a position of power determining what needs to be done in Aboriginal communities to Aboriginal people to manage the problem. And part of that is that there was a real lack of partnership or equality in those processes. So in terms of then that taking into account the historical and political context, how that influenced then also cultural context was that it was often that there was no corroborating research, and the research then that was put out was that it denigrated and dismissed Aboriginal culture. It wrongly reported about knowledge and beliefs and laws. There was a development of policies that supported this so-called research, and the most, I guess, extreme example was that Aboriginal identity was taken out of Aboriginal hands, and there was a caste system developed for identification of Aboriginality. There was also that exclusion from education that a lot of the previous social and genetic research was to support this concept that Indigenous people had a naturally inferior intelligence. It was also there was a lot of knowledge that was stolen from communities, and it didn't benefit the communities, and it certainly advanced it. The only benefit was that it advanced researchers. It impacted significantly on cultural practices, particularly around the gathering or removal of human remains. There was then Aboriginal people lost the activity of conducting burials or of their people, because of the simple fact that the human remains were taken. So in that context, there's been little improvement due to research activity. And perhaps one of the biggest was there was no accountability for unethical research because there were no guidelines in place. So out of all of that came some major influences that exist today on current research practices. So I guess it was really from the 1960s and 1970s where there was an increased political activity and protests about what was happening in Aboriginal communities. There was an increased development of Aboriginal community-based organisations and increased awareness of insensitive research, and an increased right of Indigenous ownership and protection of that Indigenous knowledge. And at the same time, there were increased development and acceptance of research guidelines for Aboriginal research. So out of that came the establishment of the AH&MRC as a whole in 1985, and the Aboriginal community was so supportive of having that right to Indigenous ownership that they embedded in their constitution. I think it says a lot about those communities at that time, that they embedded in the constitution of their peak representative body, and that they should be able to operate an independent ethics committee, and that was started in 1996. So out of that comes the current context today, I guess, in that you have the New South Wales ACCHS sector, an Aboriginal community which provides Aboriginal oversight and governance of Aboriginal health research. We have the New South Wales Aboriginal Health Information Guidelines, which was part of the partnership agreement between the New South Wales Government. We have the AH&MRC Key Principles document, which outlines the criteria for undertaking Aboriginal health research in New South Wales, and we have the NHMRC Values and Ethics Guidelines for Ethical Conduct into Aboriginal and Torres Strait Islander health research, and we also have the New South Wales Ministry for Health Policy Directive that any employee of New South Wales Health, if they're conducting research that will impact on Aboriginal people, it has to be submitted to our Ethics Committee. So I'll talk now briefly about the research projects, what type of research projects need to be reviewed by our committee. And there's 4 main research themes. So if your research is around research where there's a specific focus on Aboriginal people, the second area is around general population research, research that is not health related, and research that might fall under instead program planning, evaluation or quality improvement activities. So the first one, and this is the main type of research applications that we get, where the main research group is focused on data of Aboriginal people. So if a research project meets any one of the following, where the experience of Aboriginal people is an explicit focus of all or part of the research, where data collection is explicitly directed at Aboriginal people as a group are to be examined in the results, the information has an impact on one or more Aboriginal communities, or Aboriginal health funds are a source of funding. So this might be through New South Wales health funded projects or an NHMRC grant. If it meets any of these 5 criteria, this research application should be submitted to our committee. Examples of this might be, for example, Aboriginal mothers and their use of antenatal services, effectiveness of a health app for young Aboriginal people, and these are fictional examples, but they provide a good example. So example of a Greater Western patient recall system in hospital. Now, that because that might be a broader one, but they intend to look at Aboriginal people as a group will be examined in the results. So the second research theme is around general population research. So if the research project meets any one of the following, so if any of the 5 previous factors were present. The second is if Aboriginal people are likely to be overrepresented in the group. The third is if there is different Aboriginal experience around a medical illness or utilising, or the fourth one, utilise that there might be different use of services by Aboriginal people, or the last one is if you intend to separately identify Aboriginal data in your final results. So examples of these might be one that might look at determining the transport needs for older people at Orange Base Hospital. Now that may not look at specifically that it would have an impact on Aboriginal people, but when you're then understanding that Orange as a country town is a satellite town, it's a secondary town, it's got a large Aboriginal population, and there's a lot of Aboriginal people from smaller rural towns around that area that actually go to Orange Base Hospital. So you're likely to have significant numbers of Aboriginal people in that participant group. Other examples might be data linkage projects that tend to use Aboriginal identity when they compare against the general population. Another project, for example, might be a data analysis of North Coast motor vehicle crash statistics. So even though that's a general population research project, unless you know Aboriginal people have greater numbers of motor crash vehicles and have higher rates of injury due to motor crash vehicles, you might not think that you would get a significant number of Aboriginal people represented there, but you may indeed get that. Evaluation of patient access and early discharge from metropolitan hospitals. So Aboriginal people have the highest rates of discharge against medical advice, and they also have specific issues related to accessing hospitals. There's a large metropolitan population of Aboriginal people, so that's more likely to increase the have the group have Aboriginal people, a larger number of Aboriginal people identify in that group. So the third area is around where research projects that may not focus on health but may cover areas such as housing, education and crime. So what the committee would tend to look at is research projects that use terms such as resilience and well-being in the description or design, simply because they will have important health implications. So an example might be around analysis of water quality in a remote Aboriginal community. So while it's not specifically a health Aboriginal health research project, of course water quality is going to have a significant impact on a person's health. Another example might be around an evaluation of a Koori Court sentencing program. Even though this has more of a crime focus, if they were intending to ask around social emotional wellbeing issues around that sentencing program, there may be important health implications in that. The fourth one is around program planning, evaluation and quality improvement activities. So evaluation of quality improvement activities, they typically involve studying client records or interviews, and this might be interviews with Aboriginal clients or staff. It's a very grey and very broad area. It really is considered on a case-by-case basis, but generally researchers should submit to the committee if it meets the other criteria that I've spoken about, particularly if the report is going to be published externally, if it doesn't have Aboriginal people involved in the design or analysis and interpretation of data, and if it did receive ethics approval from another ethics committee. They should then certainly be submitted to us for consideration. So data projects and data linkage projects as well need to be considered, submitted to us if it meets the previous criteria. There's an Aboriginal focus, or it's around general population research where there's likely to be impacts on Aboriginal people or communities. If there's another focus that still may meet, have important health implications for Aboriginal people, if it's evaluation or quality improvement. And this would include data that's from hospital records, organisational data, routinely collected data, surveillance data and program data. So in terms of the contents of an application, it's similar to other ethics committees in that you're submitting a NEEF. We ask for a study protocol. If you're doing if you're seeking consent from participants, you need to include patient information statements and consent forms. The additional thing that you need to submit to our ethics committee is you must provide a written response to the 5 criteria which are listed under the AH&MRC guidelines for research into Aboriginal health key principles document, and the application as a whole needs to show evidence of principles embodied within the NHMRC 6 core values for undertaking research with Aboriginal and Torres Strait Islander people. So I'll go through each of the criteria and provide some examples of what the committee would consider meets the criteria. So the first one is that the research project needs to show that there's a net benefit and advancement of scientific knowledge. So what we're looking for in review would be what's the research approach and research aims? Are they really contributing to overcoming a health issue that they've identified? Have the researchers taken into account the historical context and resulted health outcomes? So there's been a lot before that have said there's been a benefit, but often that hasn't been the case. So has the researchers shown that they've recognised and also then acknowledged the impact of risk? Because if there's not an advancement of scientific knowledge, or there's an advancement that comes at such a risk to the Aboriginal community, there's no benefit to anyone. So examples of this would be where a researcher has provided an in-depth literature review which identified the social determinants of health. Where the researchers have sought advice from Aboriginal community people right at the design phase, and then they've been able to adjust the research to community needs. They've identified risks in identifying participants, such as, for example, particularly around injecting drug use. It's a very sensitive topic in the Aboriginal community, and a research project provided an alternative recruitment process, so there was a benefit to the community and it didn't impact negatively on those participants. So the example where there wouldn't be would be little advancement of scientific knowledge may be in a research project that aligned a particular physical characteristics with a medical condition and then linked that with Aboriginality. So the second one, and it's often the biggest one and most difficult one for researchers to meet, is around there must be Aboriginal community control within the project. So what we're looking for in terms of a review is who are the Aboriginal people involved in the project and what's the support for the project. Has there been Aboriginal involvement right at the design phase, and is that followed through in data collection, analysis, interpretation and the publication process? What's the data ownership and governance agreement for Aboriginal people? And researchers need to provide an organisational support letter from an ACCHS showing support for their research project. Examples where they've embedded that Aboriginal community control in the research project is where they might have established an Aboriginal advisory or an implementation group at each separate site where they were undertaking the research project. Other examples are where they've developed an intellectual property agreement for the use and ownership of data, and that's particularly important in this era of social media and app development, where they're taking Aboriginal knowledge and then will be using that later on to then at a cost to others. Other examples where researchers often present at community meetings and with appropriate PowerPoint presentations and with question and an answer time, and that is part of ensuring that there's Aboriginal involvement in the research project. That there's appropriate participant information and consent forms which give participants an understanding of what they're doing and why, their voluntary participation and freedom to withdraw and confidentiality secured. And if you think about that to the historical context where a lot of Aboriginal people, particularly a lot of older ones, were excluded from that education process, so there needs to be appropriate language and consent process in place to ensure that it's truly informed consent that's being provided. So bad examples, I guess, are fairly obvious around where you haven't had Aboriginal community control and where, you know, where a project's been designed and they've just sent a request to an ACCHS to support a project. And I think the biggest thing is that they have no expectation that there needs to be discussion around that project with the Aboriginal community, or they've started a project without our approval. So in terms of, I guess, Aboriginal community control in relation to data linkage projects, in terms of a review, so the review is looking at, have the researchers justified the use and linkage of Aboriginal data or Aboriginal variables. Often they'll just, we get research projects that will just say we just want to use that, and often it's because it is going to show such a big gap, or, you know, it's going to highlight, or, you know, it's going to look really good on paper, but they really haven't justified the use of it in terms of the research project. We look at that you would need to establish an Aboriginal advisory group. We prefer an advisory group rather than a steering committee. An advisory group meets the cultural criteria where Aboriginal people have input into research projects in their community. And so we're looking at that you would need to set up an Aboriginal advisory group. You'd need to consider, is a community level, state or national membership, and it should be independent from an organisation, and that it's an effective one. So there's terms of reference are set up so there's it will operate in an effective manner. You'll need to show evidence of support, whether for your project, whether it being a statewide or national body. AH&MRC is the peak body, is the most appropriate state body to seek support from. NATCHO at the national level, of which AH&MRC is a state, New South Wales state member for that, or another appropriate Aboriginal organisation. Because there's no specific, it's not the data linkage is often not specifically related to specific communities. It's really then important that there's evidence that AH&MRC has been involved right in the design phase, particularly because that's around, provides legitimacy of the data. AH&MRC is able to provide advice on the collection and use of data and what it was collected for, and around the research design and the aims of the project. The committee also look at how the researchers managing the impact on the whole of the Aboriginal community. So when it's looking at big data sets, it often gets translated as this is the whole Aboriginal community. So need to look at how that will impact on the community as a whole, and if they've taken into cultural considerations about what is identifiable and de-identifiable, taking into account as a smaller Aboriginal population and information that might be considered to be de-identified or non-identifiable. Because of Aboriginal smaller population, there's an increased risk of identification, and any project, around a data linkage project, you should certainly seek advice from myself and the committee first around setting up a project. So the third criteria is that the project needs to be sensitive to the cultural principles of Aboriginal society. So what we're looking for in terms of a review of that project is, what's the partnership approach to it? Is there a partnership focused consultation approach? Have they recognise Aboriginal cultural practices and community history? Is there consultation occurring, and what are the decision-making processes? Is there an open and transparent and flexible time frame embedded into the project? And have they looked at it as a holistic approach to life and healthcare? Because that's how Aboriginal people and ACCHS operate. So for examples would be a researcher from a university and ACCHS developing a project together, project where it might support a community request to have an external Aboriginal researcher to collect the data rather than having a local Aboriginal person, or the researcher conducted separate men's and women's groups to gather the data. So bad examples would be where biological specimens might be collected without consent, or that consent is dumbed down, and or there's no Aboriginal governance or consultation in the community. Or other examples might be where just a section of the research project that only relates to Aboriginal participants is submitted to us rather than the application in its entirety. So the fifth criteria researchers need to address is how they will reimburse costs associated with the research project. So what we look for in terms of a review is there a constructive use of health workers in the community, whether the researchers are requesting them to recruit participants or promote the research project in the community? What are the meeting costs involved? It's not only about financial reimbursement. There's also, is there a skills transfer or training? Is there a chance for on-the-job training? And what is given back to the community? So examples that have come out of research project is that a future training pathway in researchers was provided to Aboriginal health workers who participated in the project. Other examples are where participants are provided with money vouchers for participating, and where all meeting venues and meals were met by the research team. Other not so good examples are research projects that they often expect an Aboriginal health worker at an ACCHS to promote, recruit and interview large groups of participants in a really short time frame, and they don't really take into account that they have another job already. So the fifth criteria is around the enhancement of Aboriginal skills and knowledge. So what we're looking for in terms of a review is, what's the respect and embodiment of Aboriginal knowledge in the research design? Is there feasible skill enhancement of Aboriginal people, and is co-authorship going to be acknowledged? So examples of this would be where Aboriginal people are invited to be co-investigators or their research assistants on the research team, and they're then recognised that through certificate of participation or acknowledgement as being part of that research team. It's often where we have projects where they might ask the Aboriginal research assistants to co-author, but what we're actually looking at is how will they actually work with them to develop authorship skills, taking into account a lot of Aboriginal people haven't got those skills to actually co-author, and it's a good opportunity to enhance skills by working with them to develop those authorship skills. Other examples might be formulating research into a policy statement, as well as, even though you're going to publish in journal articles, putting the research data into a document that the ACCHS can actually use or benefit from. And particularly I think around encouraging presentations by Aboriginal people to present data. It can be a very overwhelming thing to present in front of a group, and encouraging Aboriginal people to develop those skills is an important part of the research project. So I guess bad examples are where it's often hard to get researchers to think of ways of how they can enhance Aboriginal skills and knowledge, and particularly, as you can see, that with them will just share whatever knowledge they have with staff members when required, but that doesn't really give us much information or it's not a very effective way of enhancing those skills and knowledge. So in terms of the NHMRC 6 core values, the first one being reciprocity. In terms of our review, we're looking at evidence of mutual interchange of ideas or favours. What's the level of engagement, and is there a benefit? Is it true, or is it an assumed benefit? Are there clear links to community health priorities with outcomes, and is it real and not superficial engagement? So examples of this would be that in the research projects, researchers, they've sought advice on ways to meet with the community, and they may be funded. So there may be an ongoing process where they were happy to put in that time and effort to meet with the community over a 2-3 month period, and that they funded those community meetings. Others were where a project was developed by the community at the grassroots level, and it was supported by a research institute to then undertake and complete the research project. Others where they provided free technology to undertake the survey, and then that technology such as iPads were then re-updated to then have other health information, which then could stay in the community and then be used as a health promotion tool. Others were where they've written successful funding application for an Indigenous program around the same research subject, or they wrote a policy statement that used data from the project to seek funding for a drug and alcohol worker or other kind of worker. Others examples have been where they produced cultural awareness and a research engagement resource pamphlet for advice for other researchers coming into the community, or they provided in-house training to ACCHS staff, for example, on cardiovascular disease on an ongoing basis. So the second core value is around respect. So in terms of our review, we're looking at what's the evidence of the consultation process, which is really about building mutual trust. The clear statements and acknowledges of respect. Are they utilising elders or the appropriate community people? Is there recognition of the true contribution that will be created by the research? Examples of these might be that there's agreements developed that involve a partnership decision-making process, and that's evidence right from the design phase through to publications and presentations. Is the consultation appropriate and timely? What's the time frame that they've given? Do they have researchers and experience in Aboriginal health? Some have decided that the new researchers coming through this particular unit, they'll undergo cultural awareness training, and they have appropriate cultural supervision as well. What's the terms of reference that have been developed and that they've been created together and agreed upon? So the third core value is around equality. So our review would be looking at evidence that participation is equal, sustainable. Is there appropriate recruitment? So is there likely to be inclusion or exclusion? Is it fair and equal? And what's the balance between burden and benefit? So examples of this might be that a research project at different sites will take into account having a different consultation process for different Aboriginal communities. Can they change the research project timeframe to include all the appropriate communities, rather than, unfortunately, where they will then exclude other communities because they can't be flexible in their time frame? Have they utilised Aboriginal people in the community in the follow-through, such as the future training opportunities or publication recognition. An example was when a research project, they originally had one Aboriginal advisor, decided then, because it was working with different communities, to create an advisory group at each of the sites. So the fourth core value is around responsibility. So in terms of our ethics review, we're looking that a project doesn't set up community anxiety and it maintains the kinship and harmony in the communities. We look at that is a means of ensuring the risk of participants is managed and there's protection of communities. And we look at what is the accountability, such as the monitoring and the community feedback or sign-off of the research between the researcher and the community. So examples of this would be where there's an Aboriginal advisory group. There's a chairperson who follows up perhaps individually with individual participants who may not have participated in the group, but they go through a culturally appropriate consultation process with each individual participant, and that most importantly that advice is acted upon. Other examples are where all decisions have gone through an Aboriginal advisory group for final endorsement before any decisions been made, that there's authorship and publication afforded to Aboriginal health workers who often aren't acknowledged enough, particularly if the health workers are recruiting, promoting, interviewing, providing interpretation into the research project. It certainly should be encouraged that they have recognition of co-authorship status. Or where research projects have agreed to embed Aboriginal voices into presentations. So often, and that's about having Aboriginal people there presenting Aboriginal data. And if they can't, that Aboriginal people from the community are put into presentations where researcher is presenting that data from that community. And of course, another example is that the language appropriate patient information statements and consent forms. So the fifth core value is around survival and protection. So in terms of our review, we're looking at the evidence that the research will not erode social and cultural practices and bonds between Aboriginal families and communities, and it will advocate for cultural differences while still recognising the collective identity of Aboriginal people. So examples of this are where researchers provided research advice on working with Aboriginal communities to future researchers. Researchers ensured that research assistants undertook cultural awareness training prior to commencement. And that was so, in both of those circumstances, it was about them protecting and operating, being able to operate and function in that Aboriginal community. Another example is that sensitive health data wasn't localised to a particular community, so when they reported on it, they actually reported you might report regionally or you might report state, rather than having it particularly identified to a particular community. Or publications highlighted different cultural practices, and that's really a reflection of respecting the diversity of Aboriginal communities, rather than a compare this community to that community approach. So the final core value is around spirit and integrity. So in terms of our review, we look to see where there's evidence that the project supports the cultural, spiritual and social cohesion of the Aboriginal community. Are there workable timeframes? Is there a credible intent to the research? And what's the process and negotiation to achieve that? And is there an understanding of the cultural heritage of Aboriginal people in the past, present and the future? So examples of this is where Aboriginal employees of organisations sat on an Aboriginal advisory group or board as independent community people, not as an employee of the organisation, which enabled them to speak freely and provide advice without fear of it impacting on their job. That advice from all Aboriginal people was respected and utilised appropriately. Where research was conducted with separate men's and women's group, that's an important cultural aspect of our of Aboriginal people. The timelines were flexible and guided by the community. And for one example also is a research project was around suicidal intent. Very emotional thing to have in the Aboriginal community, so that provided ongoing support and training to health workers to follow up with participants in the community. So I've spoken a bit about an Aboriginal advisory group. It's a good practice for all projects, particularly if you're doing data linkage projects, you need to have an Aboriginal advisory group. You need to consider whether it's a national or statewide project, or if you haven't unable to get a support letter, it's a good it's a good process to set up. Membership usually comprising of 2 to 4 plus Aboriginal people. They should certainly be at a chair or co-chair level. You could involve Aboriginal people who have an interest in the subject matter, and you should try as much as possible to have them independent from a program, employer or research team. You need to have consultation and negotiation with community agencies. It's not substituted by having Aboriginal researchers or doctors on the research team or getting the approval of Aboriginal people employed in government departments. I think if you look back to the cultural and historical context of how the research practices and the AH&MRC Ethics Committee arose, that's an important part of that. And the advisory group is to advise on approaches to conduct recruitment, data collection, analysis, interpretation, dissemination of those findings, and certainly to review draft reports and publications or presentations. So we have a formal review process similar to other ethics committees, but we do have some differences. All our applications are discussed at full meetings but are not approved at the meeting. They're actually delegated to committee members. Every research project must have at least one Aboriginal reviewer on it. We may also include seeking external advice on a project. The committee reviewers delegated to review the project will also review all the amendments and publications. Amendments don't have to be tabled at meetings, and as I've said, they're reviewed by the previous delegated members. We have 8 standard conditions of approval. We have an initial approval. We only approve first for 12 months, and that's because if any problems are going to arise, they'll usually arise in the first 12 months, and then we can provide an extension from that period. And we also have a very specific condition that any publications or presentations, they must be submitted to us for cultural and ethical review before publication or presentation. We may set up special conditions of approval, and that's usually around the support, getting a support letter from an Aboriginal community. It's very strict, and it's usually you need to show evidence that you are undertaking a consultation process with them. We don't retrospectively approve projects, but if a project has gone ahead without our review, we would like to review that report and publications. It's not best practice, but we'd like to be able to have that input. So I guess at the end, in terms of undertaking Aboriginal health research, I would say these are 3 questions to consider. So some Aboriginal communities have had hundreds of research projects written about them, yet this research has made little positive impact in their lives. You need to consider why will yours be different. The The second is that research is not the most important activity occurring in Aboriginal communities and organisations, but it's often the expectation from researchers and the expectation also that Aboriginal communities need to meet research deadlines. If an Aboriginal organisation can't or doesn't support your project, consider its importance, and is your project really feasible, or can it be flexible, and can yours be different from that? There are hundreds of published research articles that are simply an analysis and interpretation of Aboriginal data without context, understanding or validity. And you need to ask yourself, how will yours be different? So some advice would be that recognition and understanding and respect for cultural, historical and political context around research will improve the quality of any Aboriginal health research project. You need to also understand that Aboriginal people have a wider circle of relations and history. There's a strong sense of shared heritage and traditions for a group, and this does affect and influence the imparting of how we tell our story to a researcher, or even what personal information is provided, such as in a database. Aboriginal people and communities have our rich social, political, economic, cultural structure and knowledge systems. You cannot be expected to navigate your way through this without assistance, and that's okay. It's okay that you might not be understand or be up on how to do that. That's why involving Aboriginal people will help you in that process. And working in partnership with Aboriginal people, or having Aboriginal people involved in your research project, will help give context, understanding and validity to your project. So in closing, I've just put the information there. There's more information on our ethics committee, the AH&MRC as well, but the context of an application are available on the following website, and there's my contact details. I thank you for your time.
Does anybody have any questions at all? That's good. Okay, is that everything? Thank you for your time, Victoria.
Thank you.